So the first thing that we're doing, we're going to summarize what the achievements and results of VOPD. But the first thing that I want to make a highlight of is that we have transformed the VOPD product website to VOPD Knowledge Hub. So I think you all should browse into the website and look for yourself. We gather the knowledge, studies, reports, and material for inspiration to support digital transformations. So go to the website, navigate to find your knowledge to support your digital shift. So it's 8 different blocks of work that we have been attached to. Some have been done by you and me, Bengt, some have been done by others. And I'm going to run through the first 3, where the main responsibility has been on you and me, Bengt. And this is the first block is called Existing Solution, and this is where we started. We made a publication on 24 practical examples from the Nordics. And this publication was made in September 2019, before COVID. And we also translated that into January 2020, which came very handy for the rest of the world. So they could actually get inspired how to actually transform their healthcare and social care provision when COVID hit us all. So in this context, we have mapped all distance spending solutions in the Nordic countries and gathered them into the 24 practical examples. This is no pilots, no projects, just existing services that we have for the population. So we normally say that an appropriate combination of these 24 practical examples is normally addressing the demographic challenge, especially for remote and rural regions. In addition, it turned out through the COVID that this help protects the most vulnerable citizens that we are having. And these vulnerable citizens don't want to face physical interaction unless it's absolutely necessary. And guess what? There are a lot of solutions out there. So we have also made a webinar on this one, which was recorded October 2020. Implemented distance spending solution was the name, and the question was what type of solutions exist. And the webinar series was called Technology Used for COVID-19 Response. So we have also more solutions on our website, except for the 24 that I was described also individually on the website. We have 17 additional examples that you could download, and you could also get them packaged into PDF format if you want them individually. So the next block of work that we've done is connected to how to implement. When we speak about this, I remember the first conference we had the kickoff in Storuman back in the start of the project. I was struck by the fact that why don't all people in the Nordics already have these type of solutions? So we have mapped out national guides and strategies that are supporting implementation, and we have found that Denmark and Norway are having the most sophisticated guides. And the guide that we think are most holistic and that are actually speaking from a perspective of general change management, and also have the foundation on 80% culture, challenge, and 20% technology, is the Veikart for Tjänsteinnovation applied by the Norwegian Welfare Technology Program for their transformation of the municipal sector in Norway. It's translated into English, Roadmap for Service Innovation, and into each of the other Nordic languages available for your use. And we've seen that many have picked this up. We also had a second webinar on the webinar series, Technology Use for COVID-19 Response, on this topic, where Christine Standal from KS in Norway took part, describing how they've used this in National Welfare Technology Program in Norway, and how this and their ideas behind developing this guide. The next block is experience from implementation. Experience from implementation is related to 2 calls that Bengt earlier mentioned that we have conducted. One of the projects was described by Morten before. And And in total, we have had 20 projects funded by VOPD, one project by the Estonian government funded. I know that the Estonian representatives are sitting and listening here, and we're very proud that you have joined the collaboration also beyond the Nordics. And because this is a very true transnational challenge and opportunity that we should embrace, all of us. All implementation has been done by using roadmap for service implementation. And we have gathered for you in the Knowledge Hub the main findings and experience and conclusions from call 1 and call 2. And we have also a third webinar here. You can see Morten also on this picture. It's partly featuring what he has spoken about today, but the work that Redan Wagner is making, but also we have Akureyri in North Iceland taking part, both the hospital and the municipality, explaining their visions and their strategies to get how to get this type of solutions implemented. So I thought that maybe Bengt, you could give some thoughts. These were the 3 blocks that was asked of us to carry out in VOPD. What was your experience, Bengt, from this work?
I've been working with this area for quite some time, and the first reflection was that the 24 examples we give when we did this existing solutions mapping didn't really surprise me, but I was happy that we really that there were so many solutions that you said, not pilot projects or real solutions for people in these regions and municipalities. Then it comes to the second block. I know that, as you said, this is so much about culture in organization, what Morten and I talked about when it comes to silos. We need to have tools, and we are very impressed of the Norwegian Veikart for Tjänsteinnovation roadmap for service innovation. I know that there are work going on right now in Sweden to use this roadmap for service innovation that we think is very, very good, and that I think is very good decision to translate this Veikart for Tjänsteinnovation into English and all other Nordic countries have been very successful. And when you're talking about the Veikart for Tjänsteinnovation, the first 2 phases in that roadmap is insight and anchoring. And we can see through these 20 projects that we've been working with in call 1 and call 2 in a third block that some of these, foremost the first call 1 projects, they have sort of missed that. They've gone directly to piloting, choosing the technology, haven't been working with insight and anchoring. So again, the roadmap for service innovation, follow that and use that is really good. So that what I think is most important reflections from my point of view when it comes to what we have achieved through these first 3 blocks.
Thank you very much, Bengt. I'll continue. You heard me before today speak about competence provision. This is an add-on to the umbrella of activities that VOPD has taken under its wings. And the final report of this work called It's All About the People is available for you. It's a good read. Main finding, you remember, digital transformation can be a key component to create a good work environment for healthcare and social care personnel. The 4 insights presentation is downloadable, and you have also the film that we referred to, presentation of Exoter. So please look into that one. What we also have in that section is some GIFs and films for inspiration. We hope that this could even become kind of coffee table discussion between people working, professionals working within healthcare and social care, because it needs to be discussed among the staff, among the professionals. What does this mean to me? Because the evidence, at least the trends that we see, the voices that we hear, that is very positive for them. We have also a webinar made by Nordic Welfare Center, jointly with the Danish presidency, where we highlighted some of the findings at an earlier stage in December 2020 of this work. It's also a link to that one in this hub. The 5th block climate impact and SDGs trade-offs. This is where you're going to find the final report by Somi Josh's work that she presented earlier today. And that report will be launched by the end of March this year. User experience, you heard Christine Gustafsson speaking earlier today. Here you find the report downloadable. We have also the keynote speech from the final conference uploaded at this hub section for you to use. So I think that we will also have the presentation that Christine provided for us all today available at this part of the Knowledge Hub. The next step, the next part that we looked into is how to scale up. How do we make sure that people are getting access to these services? So we have given thought of this. What is the innovation potential of this field? And to be able to understand where we are going with all this, we've made a kind of simple overview of the function that wearables are having. What type of services of these 24 examples could be provided by just using a simple smartwatch? And it turned out that many of the services are available already at the smartwatches. So in future, you will most likely not only have healthcare and social care in your own home over distance, you will bring it wherever you go. And we have a case study from Norway of response services that are outlined in this one. And we have also made an episode in the webinar series Technology Use for COVID-19 Response on this topic. So the final part here, maybe it's the first part where you all should start, is connected to regional development. We have a product partner in this work that we've carried out, the Nordic Research Institution, Nordregio. And they have over the years studied the health and well-being in the Nordic region. And they have made this publication, Healthcare and Care, Regional Development Perspective in the Nordic countries. And they identified impact of digitalization in healthcare and social care on regional development in all three dimensions, connected to sustainability, economic, social, and environmental. The report has also been attached with an annex with excellent maps supporting their findings. We truly recommend this read for you. You find a link, you find the reports and a link to Nordregio's website where you can read more about the excellent work that they are carrying out. Nordregio has also made a special issue. Every second year they launched the State of the Nordic Region report. 2020 was it launched, and they made a special issue that they launched in October then called Wellbeing, Health and Digitalization Edition. Nordregio also made a final conference to sum up their work that they have done connected to VOPD, and that webinar is available on Healthcare and Care Through Distance Spending Solutions. A link from our website to Nordregio's website. So I think that's mainly what we are having. So I'm going to go back 2 slides here, Bengt. So if you give some reflection when you see this entire picture of what we have carried out. Did you expect this from start when we started out 2018?
To be honest, no. And I think this is so very good and I think, in fact, to say impressive to have all these kind of perspectives that we have contributed here out from all from a user perspective, from an organizational perspective, from a tool, how to do it perspective, from a climate impact, SDG perspective, and a perspective of how this impact the staff and how we could scale up, and also out of regional development. I think all this is a sort of piece of the puzzle to help us to go into the future when this digital transformation is the part of the solution. So I think this is contribute to that, and all these projects and all the documentation and publications we have here behind these blocks we have here, it could be and should be used when we're going further away in this steps of digital transformation of distance spanning solutions in former sparsely populated areas.
Very good, Bengt. I think I stopped there. I hope that this gave you a good overview where you can find the information and browse into the website and look for yourself. It's simple to navigate in, and you will find interesting readings and interesting information for inspiration for your next step. So thank you very much for this.